Hey, welcome to The Explainer. Today, we're diving into something really important, acute coronary syndrome. We're going to use expert medical guidelines to figure out what's really going on during a heart attack, and crucially, how to spot those surprising signs you might otherwise miss. So, when you picture a heart attack, what pops into your head? Yeah, for most of us, it's that super dramatic, chest-clutching scene right out of a movie. But what if I told you the real signs are often way more subtle? The thing is, they usually are, and knowing the difference could genuinely save a life. All right, let's get into the nitty-gritty. The official medical term is acute coronary syndrome, or ACS for short. As you can see, this is what happens when the heart muscle suffers from myocardial ischemia, which is really just a fancy way of saying there's a dangerous drop in blood flow. It's not one single thing, but kind of an umbrella term for any situation where that vital blood supply gets cut off all of a sudden. To put it really simply, think of it like this. Your heart has its own plumbing system, right? Those are the coronary arteries, and their job is to deliver all that good oxygen-rich blood. Well, ACS is what happens when one of those pipes gets slammed shut, suddenly and critically blocked. No blood flow means no oxygen, and that's when the heart muscle starts to die. Now, here's where a lot of us get it wrong. We tend to think that heart attacks are just the end result of arteries slowly clogging up over decades. And while that buildup is definitely part of the story, it's not the main event, not even close. In over 90% of cases, the real trigger is a sudden rupture of plaque that's already inside the artery. That rupture causes a blood clot to form, like instantly, and that's what blocks the vessel. So yeah, think less like a slow clogged drain and way more like a dam suddenly bursting. Okay, so this brings us to what is probably the most critical part of this whole conversation, how to recognize the warning signs. Because when you're dealing with a sudden blockage, every single second counts. The problem is, the signs are almost never what we've been led to expect. Get this. While chest pain is definitely the most common symptom, it's only there in about 75% of cases. Just let that sink in. That means for 1 out of every 4 people having a heart attack, that classic crushing chest pain, it's not there at all. So if it's not always chest pain, what should you be looking for? Well, besides that classic crushing feeling, things like shortness of breath or suddenly breaking out in a sweat or feeling nauseous, those are incredibly common. We're talking up to half of all cases. You also have to pay attention to extreme, out-of-nowhere fatigue. And then there's where the pain can show up. It's not just the left arm. It can be between the shoulder blades or even travel up into your jaw or your neck. You know, the source material for this explainer points out a really fascinating psychological symptom. This phrase on screen is Dutch, and it means a feeling of impending doom. It sounds dramatic, but a lot of patients actually report this overwhelming gut feeling that something is catastrophically wrong, even if the physical signs are kind of vague. It's like your body is screaming a warning, and it's one you should absolutely never, ever ignore. And it's really interesting how these symptoms can change depending on the person. It turns out age is an even bigger deal than gender here. So for younger patients, let's say under 65, that classic chest pain right behind the breastbone is pretty common. But for folks over 65, wow, it's a different story. Chest pain might be gone completely. Instead, the main thing could be a sudden, severe shortness of breath, or just this crushing fatigue, or even confusion. All right, so if you suspect a heart attack is happening, either in yourself or someone else, the clock starts ticking. Instantly, you are literally in a race against time, and what you do in the next few moments is absolutely critical. The steps are actually really simple, and they're non-negotiable. Number 1, and this is the most important thing, call for an ambulance, immediately. Don't call your doctor, don't call a family member, call emergency services. Second, stop all physical activity. Just sit down or lie down to reduce any strain on the heart. And finally, listen to that dispatcher on the phone. Follow every single instruction they give you. Look, the single biggest mistake anyone can make in this situation is waiting. People think, oh, it's probably just indigestion, or I'll just wait and see if it passes. You can't do that. Cardiologists have this saying, time is muscle. And it's true. Every single minute that blood flow is blocked, more of your heart muscle dies. And that damage, it's permanent. You just don't have time to wait. And whatever you do, please do not try to drive yourself to the hospital. There are a couple of huge reasons for this. First, you could pass out at the wheel, which is obviously catastrophic. But second, and just as important, an ambulance is basically a moving emergency room. The paramedics can start life-saving treatment the second they get to you. They can monitor your heart, give you oxygen, give you medications. You don't get that in your car. Okay, so you've made the call. What happens now? Let's walk through the emergency response and diagnosis. It's a really well-oiled machine, and it's all designed for one goal: get that blood flowing back to the heart as fast as humanly possible. Now, here's a really important point that trips people up sometimes. The first big test they'll do is an ECG, an electrocardiogram, which checks the heart's electrical signals. But, and this is so critical, a normal ECG in those first few hours does not mean you aren't having a heart attack. It can take time for the signs of damage to actually show up on that test. That's why if your symptoms scream heart attack, they're going to take you to the hospital for more tests, no matter what that first ECG looks like. You might have also heard about these rapid point-of-care blood tests that can spot heart damage. And while hospitals do use super sensitive versions, the official guidelines say you really can't rely on the simpler ones to rule out a heart attack. In those first critical hours, they're just not accurate enough. A proper diagnosis has to happen in a hospital with their advanced equipment. A heart attack is, without a doubt, a life-changing event, but it is absolutely not the end of the story. Thanks to some truly incredible medical breakthroughs, the outlook for patients and the road to recovery are so much better than they've ever been. I mean, the progress here has been nothing short of revolutionary. Just look at these numbers. Back in the year 2000, the chance of dying within 30 days of a heart attack was 17%. Fast forward to 2016, and that number plummeted to just 4%. That is a huge leap in survival, and it's all thanks to faster response times, better medications, and amazing modern procedures. Recovery isn't just something that happens. It's a structured journey. It kicks off right there in the hospital with procedures like PCI. That's where they go in and open up the blocked artery, often with a tiny mesh tube called a stent. Then, after the hospital, you'll typically start cardiac rehab, a guided program of exercise and support. And all of that is followed by a long-term plan to keep you healthy for the rest of your life. So living a full, healthy life after a heart attack really boils down to a partnership. On one side, you've got lifelong medications, things like aspirin, other powerful anti-clotting drugs, and statins to keep cholesterol in check. But medicine is only half the picture. The other half is you making active lifestyle changes. Better diet, more exercise, and absolutely quitting smoking. And you know what's just as important? Getting psychological support and sticking to your regular doctor's visits to make sure you stay on the right track. So when you boil it all down, it really comes to two things: knowing and then acting. Knowing that a heart attack might feel like jaw pain or sudden fatigue, that's step one. But step two is acting on that knowledge without a second of hesitation. So the real question I want to leave you with is this: now that you know what the unexpected looks like, are you prepared to act on it?